The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the Becky and Boca Show. I'm doing this remotely with Dr. Steve Fagien. Because of coronavirus, we can't be in the same studio. So we're both learning to Skype, right?
Social distancing.
Right. Okay, I've been wanting to talk to you because you are a medical doctor right here in the community. You're a very well-known ocular plastic surgeon. Am I saying that right?
Yes, you are.
Okay, everybody goes to you quite regularly, and now all of that has come to a halt, right?
Yeah. Wow, yeah.
Okay, Dr. Fagien, what are you going to do? I mean, what are we going to do about getting our Botox and fillers?
Well, it's look, this has been a life-changing experience for all of us. I mean, I absolutely, I get literally 100 plus texts a day, emails.
I was going to say your patients must be contacting you and must be wanting to get in.
Well, they're trying to get in. They want to see how we're doing. I want to know how they're doing. I had stopped operating 3 weeks ago, so fortunately, my patients. And that's
did the government make you stop, or you just?
It was essential businesses only, which I respected and actually agreed with because we didn't know where this was going. And the patients, some of them are absolutely hysterical. And as you know, some of the things you've seen, you get texts and emails. The sense of humor has gotten to be.
No, I get the funniest stuff.
An all-time high, and people go, do you know what I'm going to look like by the time I finally get to see you? You won't even recognize me. So
because nobody knows what they're going to look like. Nobody's gonna.
And I understand that. Well, that goes with hair and everything else. So I understand the beauty business to some extent. But this has been a life-changing experience for all of us, and I think we're going to have to readjust. You know, you mentioned, I'm a physician in the community, but let me give a shout out.
Okay.
And I don't want to get too emotional over it, but to those that are really on the front line, it is absolutely unbelievable. I speak to several of my emergency room physicians quite frequently to see how they're doing here in Boca and outside Florida and outside the U.S. And it's hard to imagine we're in a situation that we are in now. They are the heroes.
Yes, absolutely.
And the nurses. And in fact, I heard an interview the other night of a young oncologist who they were giving her credit for being there. And she goes, no, you don't give me the credit. It's those nurses that go in day in and stay with these patients where they can't be with their family. Those are the real heroes.
Yeah.
And I think there needs to be a reset on the way people prioritize everything. And this is a wake-up call for that. Again, I'm not complaining. I have a great practice, and it has been an amazing journey. And hopefully we will get back to that way things were, at least to some extent. But I think when something like this happens, it makes you think about everything. And everything. And I've even seen the disrespect that doctors, I do cosmetic. And actually one day, 30 plus years ago, I was a real serious reconstructive surgeon. And then I got interested in cosmetic, but I see what has happened in medicine in general. And if you think about it, they are the soldiers fighting this war. The doctors and the nurses.
And without the proper equipment, without the proper protection.
Right. They're going into an atomic war with a switchblade. And, that's a tough battle to succeed with. And most of them are doing it because it's what they feel their calling was. And I've always had an unbelievable respect for them, but even now more than ever, especially EMT nurses that are on the front line. They're trying to really save the world. And this needs to be a wake-up call for all of us, and to prioritize and appreciate what we've got. And I always think there's a silver lining in everything. I think eventually we'll see you see it, and you see the generosity of people. You see some bad things happening, obviously, and you see the worst of people sometimes in disasters, because you find out who are real and who are your friends and who are there for you and their fellow man or woman in these situations. So I think the silver lining is we'll start to realize what's important. It's really incredible. So I do not feel like I am any different than anyone else who's going through some tough times, and we'll get through it. We got to get through it together. We need to remove the politics. The politics.
That's a real problem.
It's gotten crazy. You know, whether you like the administration or you don't like the administration, this affects everybody, and we need to stop it. We need to just say, look, we got to just solve this. You want to go back to your partisanship later after it's all solved? Have a great day.
Totally agree.
Right now, we've got to focus on how we're going to get out of this mess, and I think we will. I think.
And how do you think that will be, Dr. Fagien? Do you see an end to this in the near future?
I see an improvement in the near future.
An improvement where we can start going out again? I don't see how that's going to happen as long as the virus is still out there.
And there's that concern. Now, one of the things which is a huge passion for me, and I'm on an international chat forum with people from all over the world. When this started, we started communicating with each other because I'm very academically interested. You know, I've done over 70 FDA clinical trials or investigator-initiated studies. And so I've worked with the FDA. I understand controlled clinical trials very well. But we are learning about this disease, which is really, they call it the novel coronavirus. No one's ever seen anything quite like this. This is not the flu. This is not influenza.
No, I was just speaking to someone that has it. I did an interview with a young man that has it, young, 29, healthy. He said it's not like nothing he's ever experienced in his life, and people don't understand how bad it is.
Well, and the interesting thing is the variability of the disease. So most times you get an epidemic flu. People get, pneumonia, they get all the respiratory symptoms, they get a fever, chills, and that's pretty consistent. Most people that get those type of viral illnesses. This is completely different. People get GI symptoms. I have a very dear friend of mine, a dermatologist in London, basically just got severe fever, chills, and muscle aches and unbelievable fatigue. That was his disease.
That's what this guy described.
Yeah, and it maybe affects certain demographic and age group and gender differently. We know that it has a much more higher predilection for men than women, and we don't understand why. And some people think that there's an estrogen protection, but the variability and the understanding of even the diseases that it causes. Remember, the big thing now in the country is we need ventilators. But that's based on really fuzzy science. The need for ventilators is assuming you understand the process. So that is a brand new, like this today and the last couple of days, a rethinking. Are we taking the data from China? Are we taking the data from people that have failed in many ways to save as many lives as they could based on an assumption that actually is turning out to be wrong?
Now that's very interesting because I don't know exactly what the rate of people coming off ventilators is, but I know it's very low.
Right, and then that gets into not only treatment with in an acute situation, and what some people call ARDS, or acute respiratory distress syndrome. And in the classic sense, ARDS is someone who gets a pneumonia, whether it's viral or bacterial, and they get an inflammatory response in their lungs, and they can't keep up with the oxygen levels. So they force the oxygen by putting a ventilator or applying a ventilator, which in ARDS in the classic sense, that makes perfect sense and it works. It's not working well here. And you've got to think why it's not working well. And one of the reasons is...
Very interesting, Dr. Fagien. Okay, keep going.
Well, I've talked to a lot of critical care people, whether they're intensivists, anesthesiologists, who are seeing people in the intensive care unit or intubating them, these patients don't act like the normal ARDS patients. So you remember from your medical days, even when I do surgery and have somebody simply on a nasal cannula, myself and my anesthesiologist gets a little concerned if the oxygen blood level goes below 92. We're saying, oh, they need more oxygen, we need to slow down, we need to. Okay, so we're always in a very controlled situation where we keep the oxygen level. That's why people use that pulse oximeter, where on your finger, check how much oxygen.
What people are trying to get in case they get sick with this.
Right, because when they drop typically in a traditional sense below 90, they're gasping for air, and clinical studies done for years have shown below 90 for a prolonged period of time starts affecting organs, brain, heart, kidney, liver, all these things. So the thing that always irks me is we're taking advice from science that may not be truthful, and then that gets translated to government with people that are not actually in the field seeing what happens to patients. So that disconnect is on multiple levels. If you ask people who are in the intensive care unit, these patients have oxygen saturation, that percent of oxygen, which is, again, felt to be safe above 92 or 3. Mm-hmm. Oxygen levels are dropping into the 70s, and yet they seem normal. That is not normal. Something's happening that's different. And the assumption that it's ARDS in the classical sense is completely wrong. And there's some people now that feel so strongly about that, that actually using a ventilator may be dangerous. Not in everyone.
Wow.
People. And the people
with coronavirus.
With coronavirus, I always trust the people, one, here in the United States, because they tend to be very critical. Sometimes for good reasons, sometimes for bad reasons, some for medical legal reasons, and some because they're very analytical. They want an answer to why they see something. And we're more curious here in the US than anywhere else. Not that there's not good doctors everywhere else. There's plenty of good doctors. Many of them I've talked to. A dear friend of mine who's a plastic surgeon in Italy had to become an emergency room doctor in the last month. The guy hasn't done emergency room doctoring in 20 plus years.
Yeah, I interviewed a woman in Italy the other day. I know how bad it is over there.
It's whatever you think, it's a horror movie. It's hard to even understand what is happening there. So
we've lost a lot of doctors to the disease over there.
Yes,
in Italy.
I think the last count was over 50.
Unbelievable.
And maybe underreported at this point. But so we get information based on all these graphs and assumptions and models, which again we'll talk about, which have all turned out to be not completely accurate, of no fault of anybody's, except that's all they had to go with was a model. Mm-hmm. But when you talk to the doctors in the US now, especially in New York, the epicenter here in the US, now has rivaled any country with the amount of cases and deaths. They say in the unit, things don't look right. Something is happening that they can't explain. And what's happening, interesting, is we assume if they go from an oxygen cannula, drop their saturation, that they actually need to go on a ventilator. Mm-hmm. Not finding that in everyone, unless they're extremely critical and nothing's working, is the way to go. And we may be over-ventilating people and actually causing harm because we're trying to force oxygen with positive pressure. You can do it with CPAP with a mask, remember, people with sleep apnea, or you can do it with intubation. And it's why I never intubate my patients with elective surgery, because it really isn't necessary. Now it's very safe in a controlled situation, but this is not a controlled situation. It's anything but controlled. And what's interesting is I've heard it said several times that it looks more like altitude sickness than pneumonia. The body's starving for oxygen, but it's not the ability to push pressure and the oxygen into the lungs, is that they're so filled with something that doesn't allow the oxygen to get to the blood cells, to get to the rest of the body.
So what would be better than a ventilator?
Well, that comes into other things we can talk about. The key seems to be, which again, it seems so obvious, but sometimes you got to look at something that's so obvious.
Yeah.
And what's happening here? The key is to not let them get to a ventilator. The key is we need something now, obviously, when they get to that critical stage. And again, I am not a critical care doctor. I'm just taking a lot of information, doing a lot of clinical studies with and understanding protocol on how you look at a disease entity and figure out what works and what doesn't.
Okay. So
the key is getting them to get to a ventilator.
not put them on a ventilator. There has to be something else.
Now, the intensivists in New York have found that they are trying hard now to do everything they can unless no other option works but a ventilator. And I am not suggesting, again, not being an expert in this, that ventilators don't work. They absolutely do. But in this situation, again, likened to altitude sickness, the reason their oxygen levels seem to plummet, and it doesn't cause the distress you would expect when you see somebody even in a room and they think they got to go to the unit because their oxygen saturation is in the 70s or even lower, that I've heard in some people. It's actually that their carbon dioxide levels haven't changed much. Part of your respiration is to not only bring in oxygen, but is to get rid of carbon dioxide. For some reason, the CO2 levels aren't elevated. They're staying somewhat normal, which is saving these patients. Because prolonged CO2, again, we think of everything as oxygen, is also a problem. So we're learning on the fly about this disease, and the smart, astute intensivists are realizing this is a different disease. This is not what we thought it is. And then you get into therapeutics, which I am passionate about. The president came out, and of course he likes, he has a certain style about him. And he said that he was a big fan, I'm paraphrasing, of hydroxychloroquine.
Right, which they're using.
Right, but let's take the history of that since that statement was said. A lot of people, if you didn't like Trump, went completely against that because, the president, has no medical background and he's touting a drug, and he doesn't really know about it, and that may be true. I always believe you leave the medical opinions to the experts.
Right.
Everyone's entitled to their opinion, of course. But unfortunately, there are people that just would not buy into the hydroxychloroquine effect because they just didn't like the administration. And unfortunately, I think, and again, I don't know the motives, I think he was trying to instill some hope, and he heard from his experts that it might work. So his opinion has always been, maybe we can just try it. But there was a real resistance for hydroxychloroquine because of it. And the main excuse was not the administration, was it that there was no clinical trials, double-blind, randomized trials to show or prove, which they tend to do. And I've done a lot of FDA trials, which are absolutely essential. Mm-hmm. It's safe and effective. Those are the two things the FDA looks at. And ultimately, incredibly important. And the FDA, in this situation, has done an amazing job on so many levels. But FDA clinical trials prove that something's safe and effective. That's fine if you've got the time.
If you have the time, right. Well, they are prescribing that now for...
They are. So there were many case reports in Italy, South Korea, Japan, China. A couple that said they didn't think it had much of effect, but a lot of them, which were not controlled studies, they were all anecdotal studies suggesting something's happening here, that it seems to work. And even in combination with other drugs, azithromycin, a Z-Pak, hydroxychloroquine, using zinc with it, using vitamin C. People have tried all these different types of concoctions and combinations of drugs. But what was more compelling is anecdotal case reports that were so obvious to me that there's something going on here. And when somebody says, well, there's also conflicting evidence, of course there is. The assumption has been made that it should work on everyone, and no drug works on everyone. The hypertension drugs, diabetic treatment, cholesterol medication, nothing works 100% on everybody. But if you see there is a trend and something seems to work, it certainly is worth exploring.
All right.
And in a desperate situation, if the drug is reasonably safe, which hydroxychloroquine is, why not try it? So
I've heard that some people are even using it prophylactically.
well,
People
and,
that
and
are
there's
supposed to.
and that's another
Right.
interesting topic, and that may be what ultimately will happen, certainly for healthcare providers that haven't already gotten the antibody because they've all been somewhat exposed.
Do you think they can develop the antibody without getting sick?
Yes, so because there's a lot of asymptomatic carriers, as you know, so you don't even know if somebody has it. They may not know they have it. They may be. That's what I'm saying. The variability of this disease tells me this is an unusual character. This
And
does.
some people get it very bad, and some people get it a very mild case. And the patient that I was talking to told me he thinks it depends on the viral load, like how long you're
There's
exposed.
truth to that. So a viral load with anything, even bacterial, but particularly in viral in this case, the more pathogen you're exposed to, potentially the sicker you can get.
Wow. Okay.
Somebody who walks by someone who may be positive, and they may get a little bit. And again, especially if there's an immunologic response to why people get sick, when you overload them with just an immense amount of pathogen, like healthcare workers.
Or someone living in a home with someone that has the disease.
Correct.
Would get a much heavier load than just casual contact. So they would get sicker?
Well,
Or sick?
the jury's not out on that, because some of them don't even get sick. So you see a wife of a husband who has it, and she never gets anything, and then tests positive. For some reason, she got a test, or he. So the variability on clinical syndrome is so vast that, yes, there's another situation where you may want to put somebody on prophylaxis, a spouse or a significant other of somebody who has it. But there's no proof. The interesting thing, there's not even a sure mechanism of action how hydroxychloroquine works. They think it affects the ability of the virus to penetrate the cell. That's certainly one. It has anti-inflammatory properties, which is another. I will tell you, and I've talked to several people who have been on hydroxychloroquine.
Because they had it or prophylactically?
No, because they had it.
Okay.
A very good friend of mine, his brother got the news yesterday, or a couple days ago, that he was COVID positive. And we had talked for a long time about, even before it was popular, because I had so many colleagues overseas in Asia and in Europe that had some experience with hydroxychloroquine. And I said, there's something to this. And then they put the moratorium on letting doctors prescribe it.
I know.
It was an overreach. I understood. I get it. It's kind of like everybody started prescribing it. I talked to a pharmacist once who told me the uptick of hydroxychloroquine.
Pharmacists are upset about this.
when it was a straight line up. It wasn't a curve that did this. It was in a matter of a few days, because there was some hope that it worked. But how it works is interesting. So the possibility of the use of hydroxychloroquine is to lessen the severity of the disease and to keep people off ventilators. That's how you keep people out of the ICU. So if you don't have a treatment, some people will inevitably get sicker.
Yeah.
Eventually might need a ventilator. So it's, again, the politics mixed in with fuzzy science, mixed in with, I'm so proud of, again, those frontline people that are really keenly observing what's going on and saying, guys, girls, this is a different disease. We need to do a reset. Think about different ways this works and why drugs work, why azithromycin works, why even people are touting.
Well, we didn't talk about the zithromycin yet. Why do you think that helps?
No one knows. It has a very similar cellular effect other than an antibacterial effect, and we've known that. That class of drugs, interestingly, is sometimes even used for people that have I'll just relate it to our specialty, that get nodules after fillers. And sometimes a Z-Pak is, and sometimes they call it a biofilm, but they're typically not biofilms. It's more related to breast implants and so forth. But it happens, and for some reason, which is not the antibacterial effect. Yeah, not always. Not always. Steroids tend to sometimes, and steroids work for COVID in some patients.
I was going to ask you about that. Wouldn't that logically work for steroids help in?
So there's been arms of clinical studies where they've used or not used steroids, and there's not compelling evidence either way. Again, typical ARDS, which you get from pneumonia, often respond to steroids.
Right.
Which, again, there were so many clues that this was different. It's different. And my feeling is, as these docs get better at diagnosing and appropriating the treatment unique to that individual, you'll keep people off ventilators. I think, like in New York, they're not going to need all the ventilators I predict that Governor Cuomo believes he needs. And for every reason, I hope that's correct. People don't get sick. They're not acutely ill. People aren't dying. So I think we need to rethink medicine in general. There needs to be a cause and effect. This is like nothing that we've seen before, and we need to think outside the box to get sensible solutions. Because if it was just like another disease, we'd treat it like another disease and be successful. So I think the social distancing like you and I are having right now.
Yeah, this is my new studio. I move around my house a little bit, try to find different backgrounds, but I haven't been in the studio in 3 weeks. And the last time I was in there, I was a little nervous, because you know what it's like. You're in a little box with the person, and they put us in a little bit wider box. But
3 weeks ago, I did my last surgery. I went and saw the patient by myself without any of my assistants. We both wore masks. We kept the visit as brief as possible, and that was the last patient I saw. And she was very cool about it, and she wasn't as concerned as I was, and I was concerned for both of us. And yet, and I've called her since, and she's absolutely doing fine. And thank God, so far I seem to be doing okay as well. But I think, there's, as I mentioned, there's always a silver lining. Through disaster, we always figure out something that makes us better. Whether
I'm getting a lot of hope from you because, well, for one thing, you say those medications seem to have an effect.
Not in everyone, but in a significant amount. Anyhow, my friend, I started to tell you the story about, he convinced his brother to call his doctor to put him on hydroxychloroquine, and he was very hesitant. But the doctor finally conceded because he was getting very sick. And couldn't get seen in the emergency room, couldn't even get out of bed to actually get to the
people I've talked to, they say they don't even have the strength to even think.
Energy.
Right.
And I've talked to several people that they thought it was the end. They said, okay, I'm COVID positive. I am really sick. I can't even move. Within a day of the hydroxychloroquine, and this is an N of 1, even though I've talked to many. Okay. He felt better. When he was going, now people will argue, well, he was going to get better anyhow. I'm not so sure. I think, and again, this is a drug that probably works in ways we don't completely understand.
Was he also doing the Z-Pak with it?
He did not.
Okay, so you think just the
I don't know. I don't know. It may be a magic bullet, and it may be certain people need both. What we do know by a bunch of, again, all anecdotal reports, is that if you start these drugs too late, they don't work. And the ineffectivity that people report is the experience has been in the unit when you're already on a ventilator, the drugs probably have very little effect. They reduce the viral load for sure. But once you've developed that inflammatory response beyond the viral load, reducing the viral load doesn't help much. And that's all, again, conjecture, theoretic. But I applaud the basic scientists, the people that are doing the clinical studies, especially the people on the front line, giving information based on their clinical experiences, because ultimately, in a time of a disaster, that's the most important. what kind of effect do you see by the treatments you're administering? Now, it's interesting. So you talk about prophylactic use of hydroxychloroquine. There was, again, a single case review of a rheumatologist practice, immunologist, rheumatologist, who treated lupus patients who were all on hydroxychloroquine.
Yeah, because that's the drug they use for lupus, correct?
Yes, rheumatoid arthritis, a few other diseases. Again, it's probably has a better safety profile than chloroquine for malaria. It's used for a lot of things. And the great question was asked is, are you seeing patients who are on Plaquenil or hydroxychloroquine and have lupus or any of those disorders getting COVID? And so far, and I don't know the absolute final answer, they have not found one patient yet who's become COVID positive. Now, obviously, all of them haven't been tested, but if that turns out to be true, that may suggest that it may have a prophylactic role. So that's exciting. I mean, and it was apparently a database so far that they've explored. Look, and I heard this actually indirectly from Dr. Oz, and that research is ongoing because obviously it's not only interesting, but can be very compelling for prophylactic treatment for partners of somebody who has it and people on the front line, nurses, EMT, doctors, and even receptionists at a doctor's office or people that answer phones at a hospital. Is there going
to be a shortage of this drug, or is it something that we can?
Well, it's a generic now, and it's widely available by several pharmaceutical companies that make generic. And you can ramp up, I've heard, the production of hydroxychloroquine to make millions of doses a week.
This is great news.
Well, so, I think with all the doom and gloom, again, when you
what
don't...
are the positive points here? You've got the hydrochloroquine.
You got the hydroxychloroquine, you've got a better understanding of the disease. The attempt, and they've been successful, they've been putting less people on ventilators, if you look at the trends. And I think that's key. If you can get people from getting that sick, they'll do much better. They just will. And that goes outside of COVID. If you can get people to get better.
You can prevent them from getting to that point by using these medications?
Really sick at that point. And then you can't throw those people in the non-responsive to hydroxychloroquine because there's a very good chance it would not have worked anyhow. So that's where the data gets very skewed. And you need to make sense out of it. You need to segregate your groups, the mild, the moderate, the severe, and then look at those individual groups and see who benefits from the drug. And it becomes much clearer what might work. So I'm encouraged. There are a lot of really smart people out there, much smarter than me, that are looking at this. And I think, we live in the greatest country in the world. We will figure out an answer to this. I know it. And that's aside of politics. We will figure this out because there are people, honestly, that really care.
Can you give me an idea of how long you think this might take? I love your optimism, and I know you talk to a lot of doctors and people on the front lines. Is it going to be 3 months, 6 months, a year, 2 years before we can?
It's going to be 6 months. I don't think it'll be that long. I don't. I think it'll be shorter than 6 months. I think April 30th is optimistic.
Yeah.
I think if we can get testing, and the antibody testing is becoming more readily available very soon.
Now, people do say, do you think a lot of people have already had it that just don't know they had it?
That question. We talked about that a little earlier. There are people that are completely asymptomatic that will test COVID positive. I absolutely am sure of that. They feel a little under the weather.
Or they had a virus or something in the last few months.
Sore throat. They may have gotten it in January. There are people that were outside of the country that came back and they weren't really that sick. They figured, boy, am I so lucky I didn't catch it. But actually you did.
You
and you had no symptoms. And the other concerning part, and I hate to bring any negatives, is that mutations, the virus changes, and this one might. We don't have good evidence, even though they say there are 2 strains now and probably more out there. And there may be different strains of severity. So again, we need to understand this virus a little better. And I think we will.
If it mutates, Dr. Fagien, does that mean someone could have it and then get it again in its new form, not have the antibodies for it?
That's possible. It depends on the mutation. So sometimes, and it's why the flu vaccine doesn't work on all strains of influenza, but it works on some. So, it's just like anything else. It's immunology 101. If the new virus is very similar, at least by visualization of a vaccine, it may be effective against another strain, but it might not. So, right. But I think we'll get better at it. The key, though, is going to be antibody testing to people to know who can go back out into society. Now that they're segregating people that have become positive and have recovered from COVID are going back to the hospital and feel more fortuitous, and they're out there to help. They know they're not going to get it. They're hoping they're not going to get it anymore, and they have a rather than a fear. They're out there saying, "I'm going to help mankind. I'm going to help my fellow." I liken this to the movie Armageddon.
Yeah.
And the enemy is beyond. All this fighting and politics and wars in different countries. In the end, this enemy from beyond can get us all.
Got it. So the world.
The silver lining may be, maybe we'll all wake up and realize that this is what we need to concentrate on, how we can work together. And I'm very hopeful. I think there's some countries that just won't bother to partake, but I think most of us will realize there's more common in all of us than differences. And that goes for people here in the U.S. And I think, as I said at the beginning, I think there's going to be a reset. I think people will really, hopefully, and the problem is we have such a short memory. I think people will, for at least some time, and maybe it's long enough to have it ingrained in their head that this is what life's all about. And, I'm hopeful that happens. I think it will.
Yeah.
I know it has for a lot of us. And, again, I've always had a huge respect for those on the front line, but now more than ever, they're our soldiers. They're the military. They're fighting this war.
I know.
So I've told my friends, any amount of PPE that you need in my office is yours.
Aww.
And say for now they don't need it, but I'm sure I'll get a call and it's theirs. Mm-hmm. And I encourage everyone out there who has extra PPE, give it. These people are out there saving our patients, our friends, our family, their lives. And
what would happen if they weren't there?
You know what? We'd be in big trouble. It's amazing how little attrition there's been as far as people just giving up their licenses. Because you would understand that people say, "I'm just not putting myself in harm's way." It almost never happens. That's because
that in itself is amazing, because people have families that they could get home to, but they're still there.
These superheroes, they don't wear capes. They wear a mask that sometimes is insufficient.
Yeah. Well, thank you very much. We're just out of time here.
Yeah.
To wrap up, then, you are hopeful with these new medications they're using, and you think there is something going on with the ventilators there that maybe we don't need to keep putting people on ventilators. Maybe that's not the answer.
So try not to get them there. And we're learning about ventilator settings. More oxygen and stronger ventilation is not necessarily the answer to success. And the intensivists that have had a lot of experience are saying that. So maybe gentle ventilation when it's required is the way to go. But again, I'm not an intensivist. I'm just listening to what some of my colleagues have told me.
Yeah.
And I think, again, we're learning on the fly. They're going to know a lot more every day, and we do. And they're getting better at treating this. So, God bless America. I think.
Well, that's some good news you gave us, Dr. Fagien, because it gives me hope, and I feel like there's going to be a solution soon. And
still, social distancing, absolutely essential. We have definitely flattened the curve. There is no doubt about it. Look what's happening.
What do you think about covering the mouth, covering the eyes, covering the hands when you go out? Necessary, not necessary?
Necessary. Yeah. Until we understand the disease, protect yourself to the highest level that you possibly can. So the presumption that we didn't need a mask didn't make any sense to me. This is a respiratory.
Not from the beginning. Yeah.
You know, and the reason they said that, I believe, was because there was a shortage. And
Yeah.
I agree. And we needed to preserve those PPE for the people on the front line. Absolutely true. But the message should not have been that you don't need one. It should have been
You can't get
well, you know,
Don't take them.
put it in that negative light is that there's a limited supply temporarily, and we need to save these for the people that are saving lives.
Yeah.
If you socially distance, you don't need a mask out in public.
And I think very quickly masks became unavailable for the public anyway, so it didn't really matter. But what you're saying is if you could cover your
Absolutely. You know, and I do that. So I think when you have the opportunity, even again, they talk about scarves. I've seen people put the sleepy shields that you wear when you want to cover your eyes at night, put it down to the mouth. I've seen crazy things, and you've seen all the jokes, the women's underwear.
With the ski mask, the ski goggles in Costco in Boca Raton.
Whatever protects you. I don't think you need goggles walking in public, but protecting your nose and your mouth.
But you don't think it can get in the eyes as easily?
You know, the likelihood of a casual passerby causing a contagion from particles getting in the eye. Remember, there's a viral load issue that we don't understand. So in a closed room where you got lots of people in there, social distancing at 6 feet may not even work. But outside, if you're taking a walk and no one's around, social distancing works because the particles just get dissipated quickly. But I think anything you can do to help, and again, you're protecting yourself, you're protecting your fellow man or woman, and I think it's necessary until we understand and certainly have effective therapeutics where people aren't as fearful of getting it. They say, well, if I get it, this has a 95% chance of treatment. We've got a drug that seems to be effective. Treat people when the doctor thinks it's appropriate. And that's the thing. Your doctor has the right to use an off-label product. We do it all the time.
I know. People are confused about that. They think that doctors are not allowed to prescribe it because it's off-label. But I know that's not true.
What it means is the doctor, in his discussion with you in conversation, in consultation, has discussed the risks of an unproven drug, but his experience believes it may help you. That's off-label and is completely acceptable. It's already been cleared by the FDA for safety, not efficacy for COVID, but safety. It passed the safety test.
It's
So
FDA approved. Good point.
it's relatively safe. So I'm hopeful. Look, everybody be safe out there. We're going to get through this. We've got great people. We got Becky that puts out the good word. I'm thrilled to be with you, Becky, again. I'm glad we socially distanced.
Well, thank you for this interview. I feel a lot better now.
Well, good. That's the whole idea. We need to give hope, but real hope, based on some science. That doesn't have to be a double-blind clinical study, because we're seeing patients recover, and that's great news.
Okay, well, thank you very much for joining me again. Totally different topic this time. I never thought that you and I would be discussing this pandemic that closed down the world, but here we are.
And we'll get through it. Well, there are many positives. Obviously, things that we're still concerned about, but many positives. It looks like we probably have drugs that are reasonably effective in the fight against COVID-19. It looks like we know how to treat seriously ill patients a little better because we're understanding the disease. We're understanding how the drugs may work. We've flattened the curve with social distancing. We've done things that I think have mitigated what could have been an even worse catastrophe, and it is working. New York is the epicenter now, and we're even starting to see flattening there. We're a little bit behind, so don't let your guard down. You still need to social distance. I'm optimistic that we'll probably be in some limited fashion open for business, not my practice, but businesses in general, hopefully sooner than we thought. And we'll just pray that all those things are true.
Okay, well, thank you so much for joining me, and I will speak to you soon.
Speak to you soon, Becky. Take care. Be well. Be safe.
Thank you. You too.
You have
have been watching and listening to The Becky and Boca Show. Tune in every Thursday night to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.